Medical innovations of World War I and World War II. We wanted to know what medical advances did we get from these wars that we still use today. We chose to focus on blood transfusions, triage techniques, and the use of penicillin and plastic surgery. Which of these were medical innovations of World War I and World War II? If you guessed all the above, you would be correct. First of all, before 1914, blood transfusions required both the injured and the donors to be in the same exact room. This obviously caused complications during the First World War because of the speed the doctors needed to be performing at. This changed when the use of sodium citrate anticoagulant was introduced independently by Albert Hudson in Belgium. The anticoagulant allowed blood to be stored for a few days and ended the need for the donor and recipient to be in the same room. This made blood transfusions during the war much simpler due to the fact it was difficult to arrange sufficient donors and surgeons when multiple patients simultaneously required blood transfusions. The doctors knew how to safely treat the patients, but now they needed a way to effectively prioritize the wounded. Triage, the process of determining the priority of patients' treatments based on the severity of their condition, was introduced by Antoine de Page in 1914 at the beginning of World War I. The term comes from the French verb trier, which means sort or separate. The first steps of the Depage protocol were to be followed in detail by the French and Belgian armies. The first four categories included immediate care, delayed care, minor care, or morgue. Another medical advancement that was made during World War II was penicillin. Although penicillin was made before pre-war, doctors during the war needed the factories to develop a way of making the medicine on an industrial scale since it was in such high demand. By the end of the war, the research into penicillin had changed even more. The 1945 version of the penicillin was 20 times more potent than the 1939 version. Penicillin was used massively after D-Day on wounded men. Penicillin would reduce the chance of a wound getting infected. Therefore, the survival rate and the chances of these gravely wounded men greatly increased due to penicillin. During the war, men suffered from injuries that would distort their bodies. Plastic surgery became one of the operations that was done to help the soldiers look somewhat normal after a horrific event had occurred. Many men looked unrecognizable and sometimes not even human after exposure to mustard gas or from close explosions. Dr. Gillies developed plastic surgery techniques such as skin grafts to treat serious wounded soldiers. It allowed them to live a long, normal life after the wars. Between 1917 and 1925, there is a record of 11,000 operations alone performed on soldiers. Plastic surgery is still used today, and many of their techniques were learned from World War I. Overall, there were many medical advancements during World War II and World War I. The four allowed for better chances of survival and higher chances of recovering and still having the possibility of a normal life after war.